used. Arterial circle is in the literature, journals, or textbooks. And the circle of Willis would be, of course, how some of the procedures are referred to. What you're going to find is this. You're going to find that there are two major, actually there's two here and one here, three vessels that create the majority of the blood flow to the brain. There are collateral vessels that will come off these as well, some of which are important, some are not. But for the most part, you're going to have the two internal carotids coming up through the base of the skull, through carotid canals. They're going to make a bit of a S turn as they go into the region of the brain. We're going to call that the carotid siphon. So you'll see a bit of an S turn, a sigmoid turn, and then it's going to quickly go through what we call an anastomosis and create specific branches, all of which are going to be near the area of the sella turcica, near the pituitary gland. So we'll talk about cisterns later on, but this is where you're going to find that arterial circle. Based on the modality, based on whether you're using contrast media for the vessels for a CT scan, you may or may not see all of it at one given time. Basically, what you'll have out of this anastomosis will be two anterior cerebral arteries. We'll talk about how they emerge going forward from the internal carotids. You're going to have one singular anterior communicating artery that's going to link the two anterior cerebral arteries together. And then you're going to have also another branch, or actually two vessels that come away from it, referred to as the middle cerebral arteries. Keep in mind that the middle cerebral arteries are not part of the arterial circle. We mention them because they're going to be part of what comes away from the internal carotid, and you will see them at different points, but for the most part, these two here are going to be the key members of the arterial circle. On the back side, you're going to have the vertebral arteries coming up through the foramen magnum. It's going to unite to form the singular basilar artery, and then from there you're going to get into a bifurcation, and that's going to produce the two posterior cerebral arteries. They're going to be feeding the posterior portion of the brain, and then there's two branches that are going to connect to the region of the internal carotid arteries, referred to as the posterior communicating arteries. There's two of those, and we'll map these out for you. But when you break it down, when you look at the arterial blood supply to the brain, at least on the large scale, the internal carotids and the basilar arteries, the big pipes that will provide blood flow to the brain. So if one of these become occluded, one of them become traumatized, you'll quickly reduce your blood flow to the brain by 30%. If both, for example, carotids got occluded, I doubt the patient would survive because the anterior to mid portion of the brain would not be sustained. So this is a lot of blood coming through three vessels from that end. I'm going to have you make sure you know this diagram. I know it doesn't really apply to an image, but I really find this important to be aware of. And it maps out for you those three major pipes or blood vessels that go into the base of the skull. And I'm using abbreviations, so bear with me. We have the two internal carotid arteries that be coming up from the base of the skull we talked about. They go through that area of the the carotid siphon. And then once they reach into the base of the skull, they're going to go through a process of what we refer to as anastomosis. One of the main branches that's going to form coming out this way is the anterior cerebral artery. It's going to be providing blood flow to the frontal lobe of the brain, vice versa on the other side. What links them together that forms the circle is referred to as the singular anterior communicating arteries. This is a little branch. We'll show you an example of it here in a moment. So you're going to have basically these areas formed by the bifurcation of the anastomosis created by the internal carotid arteries. What we don't show, and we'll show you later on, are the middle cerebral arteries. Once again, they're not part of the arterial circle. Here, we're going to have the two vertebral arteries coming up near the foramen magnum. Shortly afterwards, it's going to form the singular basilar artery. It's be running posterior. It will also go through a process of bifurcation. It will form the two posterior cerebral arteries, and then it's going to form two posterior communicating arteries. So what you end up with basically is the circle, as the term would imply. In the middle, you're going to have your sella turcica. You're also going to have things like optic nerves coming through this area, and some other portions of like the limbic system. There's a lot of traffic in this area, so it becomes very critical from that standpoint. The circle in general helps maintain intracranial pressure. It's a very well regulated region of the body or the brain. And when you have disruptions of blood flow, shifts in blood pressure, it has a major impact on the brain. Here, and we'll show you some different examples. I can't show you in many cases a complete circle, but this might give you an idea of what we're dealing with. Here is going to be a portion of the residual basilar artery, and then it's beginning to form the posterior cerebral arteries. We can't quite pick it up over here, and here is the residual of the internal carotid arteries forming the two anterior cerebral arteries. What's coming out toward the lateral aspect would be the middle cerebral arteries. So you kind of see them pop out here and here. These, again, would be the two posterior cerebral arteries. And again, we're going to see portions of it as it goes around, even around the midbrain. You'll have portions of the vascular system coming away, but this one probably is not the best example of that. Here is an MRA, and it does show you the majority of the circle. So what you have coming out through that siphon areas and internal carotid arteries on a bilateral basis, it's going to go through a process of bifurcation. It will form back over here the middle cerebral artery coming off laterally from both ends. It comes up anterior, and if you follow it through in this direction, these would be the two anterior cerebral arteries. The small bridge or vessel right here would be your singular anterior communicating artery. On the back end, you're going to have the two vertebral arteries coming up, forming the singular basilar artery. It will go also through a process of bifurcation, both of which will then be referred to as posterior cerebral arteries. What's missing, it's kind of hard to pick it up, and so I can't even label it for you, would be the two posterior communicating arteries. In the middle, you're going to have that cell, you're going to have the pituitary gland right over here, you're going to have the cell turcica in this area, and later on we'll be identifying optic nerves and things like that. Again, that circle pretty much is defined except for the absence of the posterior communicating arteries. Questions on that? And I have a series of segments that show different portions of it. I'm not sure how descriptive or helpful it is. For example, here's the internal carotid arteries coming up to the base of the skull. Basically over here, you're going to have over here, you're going to have your internal carotid arteries coming up over here. I had to find them for a moment. Through the base of the skull. Looking from a coronal perspective, here you're going to have those internal carotids coming up this way. A little bit of the middle cerebral here. You can see how, once again, you have that carotid siphon coming off this way. I'm sorry, this over here is the internal carotid is over here, coming off this way on a frontal perspective. Again, these aren't the best images for showing detail. Over here gives you a glimpse of the anterior cerebrals coming off this way, a little bit of the basilar artery. The basilar artery is always going to be best identified by it being posterior to the clivus. The clivus is going to be that wedge of bone right through here, which is an extension of the sphenoid bone, forming the anterior portion of the foramen magnum. Excuse me. Vertebrals will be coming up from this perspective. They're going to be starting off into the transverse foramina. It's going to run C1 is going to emerge away from the spine, and then you'll see them within the foramen magnum as two densities, whether it's MR or a contrast study of CT. Basilar artery, once again, best seen as being a structure located directly posterior to the clivus. So these don't give you a lot of detail, they just give you a little bit of snippets of where the vessels are. What you really want to do is identify the major components of the, if I go back just for a sec, the major components or branches is what we see over here. This might be the most descriptive picture or image you have of the arterial circle. So the arterial side is really quite limited in terms of the major structures that you need to know. But do know that one diagram The venous sinuses are really important to be aware of as well. They are major pipes or major vessels that carry, I use the word vessels, in reality they're not, but major passageways for venous blood. They're unique, and because of that unique quality, they're not referred to as veins, but rather venous sinuses. The two characteristics that they lack, one is a vessel wall. Secondly, there's no valves within them, which are the two characteristics you want to see in a vein. So what you have basically is extensions or certain folds or locations within the dura mater that are created so that a passage of venous blood goes through it. And we're talking, in some cases, a large volume of blood. The one that's easiest to pick up is referred to as the superior sagittal sinus. It's going to be running directly through the longitudinal fissure and basically taking blood from the anterior portion of the brain and face and taking it directly through the fissure and then directly down the posterior midline. These branches we're not going to worry about, but this guy here is very easy to pick up as a landmark. It is the biggest or largest collection of venous blood in the brain. You're going to have a smaller one, so this one's going to be located in the upper portion of the falx cerebri. In the lower folds up, you'll have a smaller one referred to as the inferior sagittal sinus. This guy, well, along with one we call the great cerebral vein, it happens to be a vein, is going to form one that we see near the tentorium, referred to as the straight sinus. So as you get near the area of the tentorium, you'll see it somewhat above it will be another venous sinus referred to as the straight sinus. Eventually, these sinuses here are going to unite along with some lateral ones, and it's going to be near the location of that bump you have in general near the back of your head called the inion or external occipital protuberance. You're going to see an internal version of that. And at that level, you're going to find where these sinuses come together. It's going to produce, rather than a consistent landmark appearance, it's going to be somewhat what I'll call like an explosion of blood. It's going to be a large collection of unorganized venous blood, and we're going to refer to that as the confluence of sinuses. Then as you work your way down toward the base of the skull, it's going to form two major tracts on either side, right and left, that generally called lateral sinuses, but the one we're going to focus on initially is going to be called the transverse sinus. They're going to run basically transverse along the brain, and then they're going to follow the petrous bone, make an S-turn, and that portion of it's going to be referred to as the sigmoid sinus. Then they're going to enter, the venous blood will enter through the jugular foramina in the base of the skull, and then from that point down, now it becomes internal jugular vein. So these right through here are all venous sinuses. Once the blood then is leaving the base of the skull through the jugular foramina, then you get into an actual vessel wall, and that's where we pick up the internal jugular vein. Up here kind of gives you a little bit of example of, this is somewhat of a limited drawing, but you have the falx cerebri over here, you're going to have the tentorium over here, and what you're going to find is that this large guy running along the upper portion of the vertex is going to be the superior sagittal sinus. It's found in the upper reaches of the falx cerebri. Below it is going to be a smaller one that runs along the lower margin of the falx that is going to be referred to as the inferior sagittal sinus. It's going to eventually join up with a vein that's coming out toward the area of the basal ganglia called the great cerebral vein. Together, they're going to combine, and then as they work posterior, it forms what we refer to as the straight sinus. It's found at the point or breach between the end of the falx and the upper portion of the tentorium cerebelli. When they all come together in these lateral branches, which we can't see, it's going to form what we refer to as the confluence of sinuses, and then eventually it'll form transverse sinuses that we'll talk about from that end. So as we go through it, before I get into that, there's another one that is really important but kind of hard to pick up from a landmark perspective called the cavernous sinus. There's a series of small venous sinus pathways or tracts that are located in and around the orbits, certainly around the pituitary gland, And they're going to be seen in the two large cavities that are nothing more than extensions of the dura mater. We call that the cavernous sinus. Why it's important is that it's the only sinus that contains an artery within it, which is going to be the internal carotid arteries. Along with that, you're going to have a series of nerves that we're going to talk about next week, also located in this region here and here. So when patients have aneurysms, bleeds, when they have tumors because of growth of tumors involving the nerves, it's going to be in a very critical area. It becomes a real important area to image in regard to potential bleeds or tumor development. So this small area right there, here's your sphenoid sinus, this is the medial wall, here's the lateral wall, and right here is going to be that extension of dura that contains internal carotid artery and a series of cranial nerves, both of which are on either side right over here. Really a very key area. So when you're doing scans, oftentimes the cavernous sinus will be an area of great interest. Labeled for you, and these come in different forms, different images, MRs, which are MRVs. Basically what you find over here, I'll start off on this side over here, is that you can't pick up the falx cerebri because we're going to be focusing on venous blood, but going from anterior to posterior, you get a glimpse of the superior sagittal sinus. It's going to run directly from superior right along the posterior midline and go straight down in this fashion. In the lower portion of the falx, you're going to have the inferior sagittal sinus, once again going from anterior to posterior. It'll run obliquely like this. Then there's going to be a vein called the great cerebral vein that's going to join up with it. And then from this point going downward and going posterior is going to be the straight sinus. So you have superior sagittal sinus, inferior sagittal sinus, you have great cerebral vein. Over here is going to be the area of the straight sinus. Where they meet, which we can't quite pick up on this image, is referred to as the confluence of sinuses. On this other image over here, same thing would apply. You're seeing a portion of it, superior sagittal sinus coming again down the mid portion of the posterior midline, not quite picking it up. Here's your inferior sagittal sinus, great cerebral vein, and then what they will produce is the straight sinus. Where they come together, we'll refer to it as the confluence of sinuses. And basically, these are the major tracts, at least seen from a sagittal perspective. These are different levels, and they won't show you what exactly we want to give you in terms of a complete picture of what you're dealing with. But here's a coronal, and what you have over here is that confluence of sinuses. What you can't pick up is where the straight sinus goes into it. Right around the inion area, that's where you're going to find the confluence of sinuses, and then it's going to produce two transverse sinuses. This is along the falx cerebri, and you have a pretty good image of the superior sagittal sinus. Same over here from that perspective. We'll get into a better image here in a second. Let me jump down if I may. Over here, what you see here's our Mickey Mouse signs. We're at the level of the midbrain, right through here. Here's our vermis. Of course, here's the midbrain itself. What you have coming off this way is tentorium cerebelli, but from this point back is straight sinus. So the straight sinus typically is going to be associated at the same level as would be the vermis, the tentorium, and you're getting into this lower portion right over here. So we associate the two from that end. Here, I'm going to focus on this one right over here, is the pons level, and this is when you get that explosion of blood. This is the confluence of sinuses. What you don't see going into it is the terminal end of the superior sagittal sinus. You don't see the straight sinus going into it from anterior to posterior, nor do you see the two lateral venous sinuses going into it. We'll show you a better example of that here in a moment. Right over here is a coronal. Here's that confluence of sinuses. Here are the two transverses here. Here's my level of my pons, evident by the fourth ventricle coming off this way, and this way would be the transverse sinuses. So the transition would be, you see the confluence of sinuses, and then as you continue down near the area of the pons, you'll be picking up elements or portions of the transverse sinuses. That will remain for a slice or two, and then you get into this area that's going to fall. We can't quite pick it up on these images near the petrous bone, and what happens, it kind of goes up this way, around, and then down. You get that S turn, therefore we refer to it as the sigmoid sinus. Here's my foramen magnum, right at this point, and this is where they're going to terminate, and what's seen below it is going to be the internal jugular veins. And here again is a different perspective. Here's the two transverses coming in, making the S turn, and when it leaves the formal skull, it's going to form the internal jugular veins. Jump ahead. This is the one I really want you to focus on. So we have that one diagram of the arterial circle. Here is somewhat of an oblique version of an MRV. And what you get is this. It kind of gives you perhaps the best map of the venous sinuses. You don't get that sagittal perspective, but here's my superior sagittal sinus coming directly down the posterior midline, right through here. Up here is the straight sinus. Where they come together is going to be the confluence of sinuses. That's seen on this one side over here. Then what is seen is transverse sinus. It makes an S turn, forming sigmoid. So it kind of gives you a whole roadmap, perhaps the best we can give you from that standpoint. So these are the major branches, except for where the inferior sagittal sinus comes in at this level. What you're going to pick up, for the most part, superior sagittal sinus, straight sinus, where they converge is referred to as the confluence of sinuses, and then they go into transverse on both sides, make the S turn around the petrous bone, and this would be referred to as a sigmoid sinus, eventually going into internal jugular veins. Questions on that? So, from a learning perspective, let me jump back really quick if I may. With all that said, a couple areas I want you to be aware of. One is going to be, sorry, giving you a flashback here for a moment. This one over here is really important for you to be aware of in terms of the key landmarks. Please be familiar with this image over here. Make sure you know what makes up the arterial circle and what doesn't, and that would be namely the middle cerebral arteries. You good, Caitlin, on your picture? Okay. Then the one that I think is important here, actually twofold. You're aware of the cavernous sinus. I think that's an important area from a pathological perspective. Here might be the best one over here. Superior sagittal sinus coming off midline along the longitudinal fissure, meeting up with straight sinus over here, confluence of sinuses. Become familiar with that image. And then, as what I just showed you, this one right over here gives you kind of a general overlay of the venous sinuses. Be familiar with that one as well. Some key landmarks being identified for you. Questions on that? All right, I'm going to shift gears and move into the ventricular system. Kind of an important area as well. So again, these PowerPoints have been made available for you to look over. And come over here. Here's one on the ventricular system. Here, for the most part, when we learn about the ventricular system, we learn about the major ventricles. We talk perhaps a little bit about things like choric plexus that produce the CSF. But we're going to introduce you to cisterns, because I mentioned earlier, areas, especially seen on a sagittal brain, that look dark. One may assume, the novice would assume it's air or open space. In reality, are going to be enlarged regions of the subarachnoid space. So we're going to talk about both the ventricular system from the standpoint of ventricles and cisterns. Kind of giving you the major points that we want you to be familiar with. First of all, the creation of CSF is going to be an application of what we refer to as the blood-brain barrier. The blood-brain barrier is a selective capillary network that is designed to allow certain things to enter into the formation of cerebral spinal fluid and keep other things out. So what happens is basically that you're going to have, through an active transport process, specialized capillary beds that are found within all ventricles that will go through a process of filtration. Certain things are able and capable of passing through that concept referred to as the blood-brain barrier. That would include things like urea, plasma, electrolytes, plasma, things like that, and certain amino acids. What's kept out, therefore, the term barrier would be certain fats, bacteria, and certain viruses in most cases. This becomes a very important defense mechanism for the brain. And when you have a working blood-brain barrier, again, the integrity of the creation of CSF is maintained to be sterile. It's clear of any major infectious agents. Blood in general is kept out. When you have a breakdown of the blood-brain barrier, which could be a tumor, it could be an infection, it could be trauma, in those cases what happens is the things that we try to keep out then will violate into the ventricular system and create problems and infections. When you have a bacterial meningitis, that's a good example of it, certain breakdowns occur within the blood-brain barrier, at least in certain forms, that allow the bacteria to pass through the network of capillaries, and this will produce infection. Same with viral meningitis. Those two are very common from that standpoint. So the blood-brain barrier is really important from the standpoint of how patients develop infections in the ventricular system, and when it's healthy, how they stay healthy from that standpoint without any of these occurring. CSF, as I mentioned, is a sterile filtrate, clear, rather viscous. It's found within the area called the subarachnoid space, which is going to run continuous from the ventricles all the way through the spinal cord and then back up. In a period of right around 24 hours, CSF, in terms of its benefits, its qualities that help provide nutritional value to the spinal cord, the meninges, things like that, is going to be expended. And at that point, it needs to be returned back to the venous circulation. What you have are small little finger-like projections that are coming away from the subdural space that reach into the subarachnoid space, referred to as either arachnoid granulations or arachnoid villi. Through, once again, an active transport process, the expended CSF is going to reach that level, it's going to be reabsorbed in a one-directional manner, and then the CSF will be returned back to the body, expelled or excreted through the kidneys, but the process continues to grow or to run ongoing. Usually in a period of 24 hours, your CSF will be replenished. The CSF is a given amount, a set amount or volume. It doesn't tolerate well in terms of additional volume within the subarachnoid space. There's a certain given narrow range of pH, things like that. So it's very, very selective from that standpoint. The thing we're going to talk about as well is cisterns. The cisterns are in large regions of the subarachnoid space. They're designed to provide additional buffering against trauma to the brain, spinal cord, things like that. So the cisterns become significant as well. We're going to identify some of those as we go through as well. What you have on a mid-sagittal perspective is somewhat of an overview of ventricles and of cisterns. We're going to talk about these as we go from top to bottom. The lateral ventricles are very easy to find out, or discover, or locate. They're found in the upper cerebrum area right over here. They're paired. They'll be separated by a small membrane referred to as the septum pellucidum. You're going to have the third, which is going to be obscured at this point. Midline, it's singular between the thalamus bodies right over here. And then you get that small passageway through here called the cerebral aqueduct, and then it's going to enter into the fourth ventricle. From this point down, there's two small openings or apertures that will lead into the remaining portion of the subarachnoid space around the spinal cord. As I mentioned before, there are set collections of CSF, or set regions of the enlarged subarachnoid space, and we refer to these as cisterns. And we're going to find out, and we're not going to cover all of these, but there are certain ones that you need to be aware of because of their location and potential for pathology. There's one found below the pons, referred to as a prepontine cistern. There's one right around the pons called the pontine. There's a real important one that's found between the Celotristica pituitary gland, and the midbrain, referred to as the suprasellar cistern. This area right over here. There's another located posterior that is between the vermis and the pineal gland, referred to as the superior cistern. It used to be referred to as a quadrigeminal, and few others that we're going to encounter. But as you work your way through, you'll see different either ventricles or cisterns as you go through the different levels of the different landmarks. Here, I'm going to take you from a top to bottom perspective. What you run into right off the bat is going to be the beginning of the lateral ventricles. Here we have kind of a diffused large area. This is going to be the body of the corpus callosum. But right off the bat, you're starting to pick up the image of the lateral ventricles. As you work your way down, you see them very characteristically aligned where they're going to be symmetrical, at least in the normal brain. They're going to be paired, and there's a very thin lamina or membrane referred to as the septum pellucidum. They separate the two lateral ventricles. Very easy for you to pick those up. We won't get into these guys over here, but I'm sure that you've heard about the Freeman and Monroe. Those are no longer the case. But you're going to have, again, some openings that lead to other ventricles, in other cases, cisterns. Now what was referred to as the Freeman and Monroe is referred to as the interverticular foramen. See that twice. And what's going to happen is the CSF interventricular, here we go, leading into the third ventricle. Again, it's not going to be visible from our standpoint. Here we have lateral ventricles. We have the two horns. Again, the anterior horns, posterior horns. And then what you see as you transition down, right along the midline, will be the third ventricle. You find the third ventricle best seen between the thalamus right over here. Here, this one doesn't show it up really well, but right down the middle is going to be your third ventricle. So you go lateral ventricles, third ventricle right over here. There's a connector here between the two posterior horns called the trigon. The trigon allows the flow of CSF into two smaller horns called the temporal horn. So you have anterior horns of the lateral ventricles, you have posterior, and then as you work down toward the temporal lobes, you get into temporal horns, which we don't see really well. It's the trigon that allows the flow of CSF between the posterior portion of the lateral ventricles and the temporal horns, which we'll look at kind of briefly as you go through. Here's what's going to get kind of busy, is that the midbrain has a lot of what appear to be spaces. In reality, it's surrounded by some key cisterns. So when we look at Mickey right over here, we see the cerebral peduncles right over here. You see the midbrain right through here. And right what we refer to as Mickey's mouth is the cerebral aqueduct. This is going to be the passageway between the third and the fourth ventricle. So this becomes an important landmark from that standpoint. What appears again to be black is a collection of cisterns or enlarged areas of the subarachnoid space. The largest right over here, which is right above the Celotristica, and I've identified these for you by abbreviation, is called the suprasellar cistern. It becomes important from the standpoint of looking for hemorrhages or bleeds of the arterial circle. Other tumors involving optic nerves can be seen in this area. So from a clinical significance perspective, the superior sellar cistern is really important. There's another one right between the ears of Mickey, and these are peduncles. So we call this an interpeduncular cistern, found right between the ears of Mickey. Along the head over here is one referred to as the ambient cistern, and then finally back over here is one referred to as the superior cistern, which I've somehow left my labeling off. So what you have here is a lot of your cisterns. You're going to have the suprasellar, the interpeduncular, the ambient right over here, and then one left my tag off here is called the superior cistern. It's located between what we see it as between the vermis here and the tectum of the midbrain region. So this is kind of an important level. You get the majority of your cisterns at the midbrain level. From a CT perspective, oftentimes the suprasellar cistern will be a black area right over here. You'll pick up a little bit of the petrous bone right through here. You don't get a lot of details we'll see with MR, but this would be the suprasellar cistern. Here on a sagittal MR is my pituitary gland, my sella turcica. Here's the upper portion of the midbrain that happens to show an aneurysm bleed in the area of the suprasellar cistern. Here, from a coronal perspective, we have our two horns of the lateral ventricles. Here, right through here, somewhat asymmetrical, is once again the region of the suprasellar cistern. Once again, because of the location of the arterial circle, this becomes a key area to examine in advanced imaging. Pons, we've now transitioned from the cerebral aqueduct, we're getting into the fourth ventricle. We have another cistern over here called the pontine cistern. It's located, of course, near the pons. And this becomes an important level. We'll get into cranial nerves on Tuesday, but at this level you pick up a large cranial nerve. That's what this line is here. And here we'll get into that later on, referred to as the trigeminal nerve. But it goes through another cistern called the cerebellar pontine angle, the CPA. And we'll find out why that's important here in a second. But basically, there are a lot of nerves and blood vessels that go through this area. And once again, it becomes a key area for identifying if there's an aneurysm, if there's a bleed, if there's some pathology in that area. So what you have over here is the pontine cistern. You have the cerebellopontine angle. Over here is the fourth ventricle. And back over here, see that explosion of blood? Is what we talked about earlier. Here is my confluence of sinuses, and it's going off on both sides, forming the transverse sinuses. Here's the CPA, and just kind of give you an idea of what's going through it. When we look at it, and again, what you're seeing in terms of a landmark is right here and right here, basically lateral to the pontine cistern. But when you dissect it, what you end up with is a real reflection of all the nerves that go through that area. That's what these beige colors are, some blood vessels. You have a large one in the form of the trigeminal that goes right through it, all of which is prone to both tumors and bleeds in that area. So that CPA is going to be a real important area to at least be aware of from that standpoint. You don't need to know this information, but it gives you a shopping list of the structures located in that region of the CPA. That's a lot of vessels, a lot of nerves that go through it, and potential for tumors to form is quite great. Then right below the pons, you get into one more, referred to as the prepontine cistern. It's associated with the medulla right over here. Here's my foramen magnum. Back over here, we'll see it on the next level down, is my final cistern, which was referred to as the cisterna magna. Now it's referred to as the cerebellomedullary cistern. It will begin between the hemispheres of the cerebellum and then extend below the foramen magnum. And that's one of the reasons why you're able to do cisternal punctures for myelograms. So what you have over here is that cerebellomedullary cistern as it goes through the foramen magnum. Here are the two vertebral arteries. Here's your spinal cord starting to form right in that level. Right through here is your cerebellar tonsil. So right over here is your cerebellomedullary cistern. That's a lot, isn't it? It's a lot.
Yeah.
Okay. It is, and we're going to review it by starting now. And I'm going to identify which ones are really important to be aware of. But again, I had to give you this large, broad picture of both the cisterns and the vessels because, again, it carries a lot of significance in the area of advanced imaging. When patients have bleeds, they have aneurysms, they have tumors that form in these different areas. They show with certain deficits, for example, facial paralysis. You have to know where to look. So I'm trying to give you a general focus of where to go or look for possible tumors or masses in that area. Okay, questions? On a coronal perspective, here's a drawing. Here basically shows you two lateral ventricles in its entirety. we can't quite make out the anterior and posterior, or reaching down. We didn't show good examples of it, are the two temporal horns of the lateral ventricles. Here, this one coronal is going to be the lateral ventricles with the transition into the third and then into the fourth ventricle right through here. Kind of maps out the three major ventricles right through here. Again, what you don't pick up really well are the temporal horns. We'll show those on a contiguous collection of images. Questions on that? It's a lot, I know. Here's what we're going to do. We're going to take you through top to bottom and try to put some continuity to what we just covered. So this was from this week's contiguous slices. So what I'll do now, for the most part, is walk you through the major landmarks. The limbic system really is the only thing that we have left out. We'll cover that on Tuesday. We'll get into things like hippocampus. We'll get into things like fornix, things like that. But you have 90% of the landmarks that you need to be aware of. So I'm going to take you along the sagittal and identify key structures as we do so. Cerebrum, right over here. And again, you've heard these before. Corpus callosum, right through here. The four components would be rostrum, genu, body, splenium. Here is lateral ventricle, thalamus, right through here. Brainstem, which includes medulla, pons, midbrain. We'll find out these things are called mammillary bodies on Tuesday. But what you can't appreciate, here's my third ventricle being obscured by the thalamic bodies. This linear line is going to be the passageway between the third and the diamond-shaped fourth ventricle in the form of the cerebral aqueduct. In and around midbrain and the brainstem, you have several cisterns. Here, at the level of the medulla, you have the prepontine cistern, you have the pontine cistern, and right above the sella turcica right over here is going to be the suprasellar cistern. Within the pontine region, you have a partial density right through here that's linear, that's going to run posterior to the vermis, which is going to be your basilar artery right over here. Back over here is the tectum, and then over here is going to be my superior cistern. Adjacent to the fourth ventricle, vermis up here, it's going to give way as we work our way down into cerebellum. Questions on that? Oh, one more thing. Superior sagittal sinus running through this area along the falx cerebri, coming straight down through here. Straight sinus, and then that linear line right over here is going to be the tentorium cerebelli. That straight sinus is going to come back and actually pierce through the tentorium, and this would be the area of the confluence of sinuses as you work your way down. Another perspective, we'll get into more of that when we get into limbic system, just different pulse sequence. Again, corpus callosum, rostrum, genu, body, splenium, lateral ventricles, somewhat of the thalamus. The midbrain's kind of hard to pick up. The brainstem seen over here. Fourth ventricle, cerebellum over here. Tentorium cerebelli, that linear line that runs somewhat downward like this. And other structures we saw better on the previous midline, sagittal. Excuse me. Upper cerebrum. When you look at this area, very few landmarks that you need to be aware of. You have the longitudinal fissure. Now, because we have three possible structures in that area, one could describe this as either longitudinal fissure, falx cerebri, or a portion of what runs through it in the form of the superior sagittal sinus. These upfolds are called gyri, little valleys are called sulci. That's the uppermost portion of the cerebrum. Going down, go down one more. What's left of longitudinal fissure right through here. The two hemispheres of the cerebrum. But here you have your bursts of white matter tracts over here, which is bilateral. We'll call that centrum semiovale, right over here, which is a large collection of white matter tracts. Once again, false cerebri or longitudinal fissure, but because of the pulse sequence we're working with, this is where we expect to see the superior sagittal sinus along the posterior midline. But the key structures here are going to be the centrum semiovale. Working your way down, we get into the first glimpse of the lateral ventricles. What you have, a little bit more of the body of the corpus callosum. But things that we could clearly identify: lateral ventricles, early signs of septum pellucidum, a portion of the corpus callosum, the genu, back over here, splenium. The first set of basal ganglia, which are somewhat worm-like but found adjacent to the lateral ventricles, would be the caudate nucleus as they run in this direction. They have three components, one of which stands out as an important landmark. Here would be the head, the body, and running posterior, the tail. The head is going to be the most evident structure from that standpoint. Going down, now we have better definition of, right through here, of the septum pellucidum, lateral ventricles, once again, genu, splenium, a little bit more of the basal ganglia in the form of the caudate nucleus right through here. And what I didn't really clearly identify, whenever you see stuff in the ventricles that is enhanced, that will be referring or representing choroid plexus, which is that specialized capillary beds that actually produce the CSF. So anything in this area would be the choroid plexus. Going down here, once again, now we have anterior horns of the lateral ventricles, posterior horns of lateral ventricles. What's left right here of the septum pellucidum, genu, splenium, head of the caudate nucleus, and early on transitioning in, you have the second group of basal ganglia evident by these gray matter structures. These will turn out to be the lentiform nucleus. Here, anything that looks within the sinuses that's somewhat like spaghetti is going to be the choroid plexus. We're not quite forming the third ventricle, but soon. Continuing down, here we have head of the caudate nucleus adjacent to the anterior horns of the lateral ventricles, genu, splenium, posterior horns of the lateral ventricles, choroid plexus, now directly down the midline, the transition into third ventricle. These two structures form the lateral walls of the third ventricle in the form of the thalamus. Here, lentiform nucleus seen over here and over here, made up of two components. One is the globus pallidus found medial, and then post or lateral is going to be one called the putamen. Two major bands of white matter tracts, one found between the head of the caudate and lentiform nucleus, somewhat of a boomerang appearance, is going to be internal capsule here. External capsule is going to be found lateral to the lentiform nucleus. On this side, internal capsule. Over here, lentiform nucleus. Outside of it is going to be the external capsule. From a coronal perspective, once again, gives you the same anatomy. We haven't got into this guy, a little fork-shaped, C-shaped structure. That's called the fornix. But what you can pick up, more than likely, genu, you have what's left of the septum pellucidum. Horns, probably going to be the anterior horns of the lateral ventricles. Here we have caudate nucleus, internal capsule, right through here. Here's the lentiform nucleus, and then what's outside of it is going to be external capsule. Here a little bit of the fourth right through here. Here's the lateral fissure here and here, and I haven't really emphasized it enough, but the fifth lobe of the cerebrum is going to be found just medial to it. It's referred to as the insula. We'll look at this here better at the next level down. Here you have the lateral fissure right through here, and it's hard to see it as a distinctive structure. is going to be the area of the insula. Things that we saw before, again, genu, splenium, anterior, posterior horns are the lateral ventricles. Thalamic bodies are seen here and here, not clearly or not well seen over here and here, but they certainly are there because here's my third ventricle. And here's that connector between the posterior horns of the lateral ventricles and the temporal horns called the trigone. The trigone is seen right over here. Once again, lateral fissure. And this is where we expect the little gray matter structures running here and here would be the fifth lobe of the cerebrum, referred to as the insula. Continuing down, third ventricle seen over here. Thalamic bodies are right over here. You see a certain amount or collection of choroid plexus. We're leaving the area of the lateral ventricles behind us. Pretty much get a little hint of head of the caudate nucleus, what's left of the lentiform nucleus, external capsule on both sides. Once again, on the medial side of the lateral ventricles would be the insula. Third ventricle, once again, these are very subtle changes in our slice level. Here is an area of a cistern, which will turn out to be the superior. But right here, be aware of this round structure, which is the pineal gland, right over here. Third ventricle, thalamus over here, superior cistern, and back over here is the pineal gland. Getting down to midbrain, you're going to have one more level. This one's better seen. You have a lot of anatomy in this area. You have midbrain itself. You have cerebral peduncles. You have the passageway between the third and fourth ventricle in the form of cerebral aqueduct. Vermis on the midline transitioning here, which is the communication tissue between both hemispheres of the cerebellum. Coming off as a wishbone right over here is going to be a portion of tentorium cerebelli. Back here now is beginning to form the straight sinus. So it starts above the tentorium and begins to go down this way. Here is that suprasellar cistern right through here. Other cisterns that we have, interpeduncular cistern between the ears of Mickey. Around the head of Mickey is the ambient cistern, and then found between the tectum, which is right over here, and the vermis is the superior cistern right over here. So again, interpeduncular, suprasellar, ambient, and superior cisterns. That might be where you have the greatest collection of these cisterns. Going down, we'll get into this one later on. We'll get into this guy over here. Here we have the transition between the pons and the midbrain, so we won't worry about this yet. But things that we can pick up here would still be one of the cisterns. We'll find out this is the pontine cistern. Basilar artery over here. Back over here, vermis continuing to grow within our field of view. And all this is going to be straight sinus back over here. Working our way down to the level of pons, going from anterior to posterior, clivus, here is basilar artery, pons, pontine cistern. Out here, you see actually some nerves coming away from it, is an area called the cerebellar pontine angle, or CPA, right over here. Fourth ventricle, arms around the fourth ventricle are called the superior cerebellar cistern, superior cerebellar peduncles. Explosion of blood back over here is going to be the confluence of sinuses. Working our way down to the medulla, you have the beginning of the foramen magnum, the basilar artery. Down here is the prepontine cistern, medulla, inferior cerebellar peduncles, vermis, both hemispheres of the cerebellum. As we work our way down, medulla, prepontine cistern, here cerebellar hemispheres, and those two things that we have to be aware of called the cerebellar tonsils. And then as we work our way through, and by the way, these are again that sigmoid sinus is coming off this way. And basically at the end of it, what we have are the pons, the two vertebral arteries, foramen magnum. Here, cerebellar tonsils. The other sinuses are gone, and pretty much that's it. Okay? That's a lot, I know. Okay?